I think what they really need to try to do is try and give their workers better hours, because obviously there's a lot of, especially junior nurses and doctors, working overtime and they're getting too tired and oftentimes they're making mistakes and stuff. And I think people just need better hours and better breaks, and like the actual workers there need to be looked after better, not necessarily the patients, although obviously they are a big deal too, yeah. I think the big one is probably mental health, because there's obviously a lot of stigma around people who suffer from things like depression and anxiety and bipolar disorder. I take antidepressants, and it is really, really difficult, and I think a lot of stuff should go towards trying to destigmatise, the issues around mental health and around learning disabilities as well. Doctors will try everything before they try talking to you about mental health. If you go in and say that you're overtired, that you're not eating right, they'll try and fix everything else before they talk to you about your emotions. And I think it's really important that doctors listen to, especially women and young people and people of colour, because there's a lot of doctors have biases because they think a lot of women and young people are very just over emotional and they're not telling the truth. And I think it's really difficult to get an accurate diagnosis around your mental health if a doctor doesn't believe your symptoms. So I think it's really hard. It's really, really hard for a lot of people, again, young people and women and people of colour especially, to go in and talk about their problems to a doctor when they don't know if they're going to believe them.